When one of your shoulders begins to feel stiff and painful for no reason, it can be frustrating that it limits what you're trying to do during the day. How can you ensure that you can get back to doing the activities that you want to do? If your shoulder does start to feel stiff and painful without any reason at all, you might be having a frozen shoulder. By the end of this video, you will know what a frozen shoulder is. With this information, you can seek the treatment that will help you get back to doing the things that you want to do. Hi, my name is Chris Brandt. I'm a physical therapist at EW Motion Therapy. I've been treating patients for about 7 years, and on a daily basis, I see several patients trying to recover from frozen shoulder. Today, I want to teach you about what a frozen shoulder is, the potential causes of a frozen shoulder, and how physical therapy can help you recover from that frozen shoulder. First, I want to explain to you what a frozen shoulder is. So a frozen shoulder is an inflammatory process that happens in your shoulder joint that causes adhesions or a thickening of the tissues that surround the shoulder joint. And during this process, we have great limitations in range of motion, and we have a lot of pain while trying to use the shoulder. There are two distinct types of frozen shoulder. There's the primary, which typically comes on without notice. We're not sure why it happens, and that is yet to be discovered. There's a secondary type that either comes from injury or immobilization after surgery or any other type of immobilization that you might have to have. There are 3 distinct stages of frozen shoulder. The first stage is the freezing stage. And in this stage, you're going to have a lot of pain as this inflammatory process starts to build in that shoulder joint. You're going to start to lose range of motion gradually, and you'll notice that you just aren't able to do the things you want to do. This pain will happen a lot at night. You'll be unable to get very comfortable in static positions. The second stage is the frozen stage. And during this stage, you won't have as much pain, but your range of motion is going to be severely limited and may even be increasing in limitation. The third stage is the thawing stage. And during this stage, you won't have as much pain, but your range of motion will gradually start to come back. Secondly, I want to talk to you about what causes a frozen shoulder. Currently, there are no known factors that cause a primary frozen shoulder directly. There are some factors that have been shown to give you a greater risk of frozen shoulder, such as diabetes, thyroid disease, Parkinson's disease, cardiac disease, and hormonal imbalances. Frozen shoulders happen in about 2 to 5% of Americans, mostly in women ages 40 to 60 years old. The secondary cause of frozen shoulder, as we discussed earlier, can be caused by injury or prolonged immobilization, where that inflammatory process is really caused by an outside source. The condition can last anywhere from 6 months to 2 years, and in some cases it can be very helpful to get intervention early in that process to try and reduce symptoms, but also decrease the length of time that you may have your frozen shoulder. The third thing I want to talk to you is about how physical therapy can help you if you have a frozen shoulder. A lot of times as a frozen shoulder is developing, you may not feel that anybody will be able to help you. But physical therapists will take into account your pain levels, your current range of motion, and any other factors that are starting to inhibit what you're able to do during the day, and start to build a plan around those symptoms. So, for example, in the earlier stages where you're having a lot of pain and the shoulder is just starting to get tighter and tighter, a physical therapist is going to help you develop a way to manage that pain, whether it's through ice or any other modalities that may be helpful. We'll also be trying to preserve the range of motion that you do have through very gentle exercise, manual therapy, and anything else that we feel could be beneficial to you. In the later stages, when you're not having as much pain, but the shoulder is starting to get stiffer and stiffer, a physical therapist is going to be a great resource to aggressively stretch that shoulder and try to get as much range of motion as you can at the time so that you're able to use it. And at that time, hopefully we'll be able to get into some strengthening exercises which will greatly benefit you down the road. Now you know more about how physical therapy can help with the symptoms of a frozen shoulder. Along with doing your home exercises regularly, ice can be very helpful in reducing pain, and heat can be very helpful in reducing muscle tension in the muscle surrounding the shoulder joint. Click the link in our description below to watch our video about ice or heat. This video explains when ice, heat, or both are helpful when recovering from an injury.
If you found this video helpful, be sure to give it a thumbs up and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.